So today we're joined by Amanda Glassman, the Executive Vice President and Senior Fellow at the Center for Global Development. She's an expert in priority setting, resource allocation, and value for money in global health. So she's a really important mind to pick right now on the global pandemic and as it evolves. Thanks for being with us, Amanda.
Thanks a lot. Great to be here.
And we're going to just, jump right in with the first question, which is, there are billions of dollars that have been committed to COVID relief and vaccine development. What do you think should be top of mind for resource allocation at this time in the immediate and then in the long term?
Yeah, although this is an unfolding outbreak and there's still a lot we don't know, a lot of uncertainty, I think it's pretty clear there are some top priorities of things we have to do immediately. So one is to protect healthcare workers, to make sure that they have the PPE that enables them to continue to work, both in response to COVID-19 and in response to other public health priorities. And this is something that we've been particularly worried about, as we've seen very significant lockdowns and kind of shutting down of health services that are providing other things besides COVID-19. And I think that's a mistake. We need to find a safe way to provide childhood immunization, reproductive, maternal, newborn, and child health care, even cancer care, diabetes management, dialysis. These are things you can't not do. Of course, we should find safe ways to do them. We should experiment with telehealth. But I think at minimum, we need to have basic health programs operate and have health workers stay safe through the use of PPE and other appropriate measures. So that's the first order priority. There's another set of things like hand washing and safe water for communities that are likely to be affected. That's something that was on the agenda before COVID. It should be doubly on the agenda now. There's also the huge economic shock that lots of the low and middle income countries are facing, independent of what happens with the COVID-19 outbreak. And so there we're looking at some really interesting cash transfer, other kinds of social assistance schemes that try to smooth poor families' consumption, because that can also have a really big impact on health and nutrition as well. We've seen food prices rise in some cases. I don't think we've seen data that illustrates that there's a huge food security issue at this point, but we might be right on the edge. So just sort of thinking ex ante about how to deal with that, I think is really important. So those are sort of top priorities. In terms of vaccine development, there's of course lots of conversation about how to do this, and billions of dollars have been put into what we call push funding by CEPI and other groups. In the United States, we have a new program called Operation Warp Speed, which gives you a sense of the aspirations for this vaccine project. And because, a vaccine really is the exit strategy to the situation that we're living in right now. At CGD, we've been arguing that we need to complement some of those push funding mechanisms that just give straight subsidy into labs that are working on the research and development of vaccine candidates with what we call pull mechanisms. So putting up some money, sort of pre-contracting for a vaccine that would be high value for money in, like, let's say, low and middle income countries, and that would be assured for them to have that supply. So that's an idea. We're calling that the Benefit-Based Advanced Market Commitment. We're working on that idea and happy to talk more about that if it's of interest.
Okay, great. Yeah, sure. I would love to hear more about that idea. I think that you brought up an interesting point in terms of priorities and allocation of money. It was sort of like, okay, what are the crises that are ongoing that we need to be tackling, and in addition to COVID-19, right? I think that's really interesting, which we can get to later. But first, let's hear a little bit more about the pull mechanism that you're describing. Yeah.
The Benefit-Based Advanced Market Commitment, that we are abbreviating to be BBAMC. So it's an idea basically that says, I want to say up front what kind of product, what kind of vaccine would work best for my country, that would be worth it for me to buy, right? Because, at start, obviously countries have different age structures, right? So my capacity to benefit as Malawi, where less than 2% of the population is over 65, versus my capacity to benefit as the United States, where 16% of my population is over age 65 is totally different, right? And those are the high risk groups in this case. So a vaccine actually has to be much more efficacious to be worth it to buy, or you might just pay a different price. You'd be willing to pay less because you have less capacity to benefit. So the idea is to sort of help the world community come up with a target product profile of what efficacy and what efficacy looks like and what that means for price for in different settings. And the other part of it is sort of saying, how, upfront, how much would you buy if it was available today? So, one of the problems that we have right now is a kind of vaccine nationalism. People are talking about how, if it was developed in the United States, they would, manufacture enough, they would vaccinate US citizens first before vaccinating, allowing vaccination to go to the rest of the world. So people are thinking about different ways to deal with that. But we think that pre-contracting might be a good way. If you have a kind of joint purchasing mechanism where countries buy in for certain numbers of doses, you're sort of assured of your share of the dose because you've already paid. You've paid up front. You've made a commitment to pay up front. It could be guaranteed by the international financial institutions. So that's the other part of the idea, because in the current scenario we have the U.S. and China, and then the Europeans and the U.K. putting up a lot of money up front and promising for low and middle income countries. And that, maybe for Gavi, we do low income countries, but for those big middle income countries that actually are the ones that are going to demand the most doses, they don't actually have a way to pay in to get their share of the vaccine. So the idea is sort of giving them a mechanism to buy in to pre-reserve their share of the vaccine.
Okay. Is there anything in recent history that you're modeling this off of? What sort of lessons have you learned in the past that
Yeah.
you want to avoid with this vaccine?
So, 15 years ago, this broad concept was tested with Gavi, with G7 financing for the purchase of the pneumococcal conjugate vaccine that was tailored to pneumococcal disease as it was circulating in low-income countries at that time. And it was a product that was already sort of through phase 2. And under normal circumstances, a vaccine would take about 25 years to get to low income countries, right? And so the idea was to pool the demand for low income countries and say, we'll buy a pneumococcal conjugate vaccine at this price in this volume if it's ready. And they actually, through creating that, it was called an advanced market commitment, and it was developed at Center for Global Development with Michael Kramer, who won the Nobel Prize for Economics last year. And it was picked up by Gavi, and that AMC was tested and brought to market a pneumococcal conjugate vaccine. I think they bought 250 million doses, and it's sped the time between when a normal vaccine would make it out, or at least historically the time between when a vaccine was developed and when it made it to market. So it went from like 25 years on average to about 3 years. So that's a huge gain in access, and it was because it was more like an advanced purchase commitment, to be honest with you. So it was tested by Gavi 15 years ago, and it worked to speed the time to development and deployment. So the idea is that the same concept could work, and we've just added some design features to try and get middle-income countries in on the game, right? Because right now, that's just for low-income countries that receive funding from Gavi. So our benefit-based idea is to bring in the middle-income countries and to sort of develop a tiered price that they would pay for it based on the benefit that they would receive. So it's like Gavi Plus, Gavi UNICEF Plus. Let's see, we're still developing it, but that's the idea.
Yeah. And so from kind of a logistics standpoint, especially if we have communications professionals listening in or watching, you have an idea. How does the Center for Global Development get this idea out, and how do partners help in advocating for it and sharing it?
Yeah, so we're really just starting that phase. I think the AMC concept is now pretty mainstream in the sense that most people that work in global health are familiar with it from that earlier Gavi experience. And now what we have to do is get together with other organizations in the field, socialize the concept, talk about how it might be modified. There's this accelerator initiative that's being led by the World Health Organization, and Gavi will obviously be engaging with that group to discuss the options. We'd also like to influence what the US does with their own Operation Warp Speed and whether, I mean, I think the big play here, or the more general issue is, how global is this pull mechanism going to be? And why wouldn't we give a chance for middle income countries to buy into an efficacious vaccine and pay a fair share? Even those, the most conservative commentators in the United States presumably would go in, they would like that because it's more volume, which is going to reduce the price for everyone. So we'll see. I mean, there's also, UNAIDS issued an open letter a couple days ago that talks about, the importance of having access to everyone and having that vaccine be free of charge to everyone. But to do that, we have to pay for it in advance. We have to set up the financial architecture to make that happen. And if we sort of let the ad hoc process go on, we're going to be stuck with, not stuck with, it's really great, a low-income country purchase commitment for Gavi, and the high-income countries taking care of themselves. And then what happens with that big group of middle-income countries, which concentrate the world's population, by the way. So if we really do care about a global vaccine and the people's vaccine and all that, we have to set up the mechanisms now to enable everyone to buy into it.
Yeah, and it seems like the benefits of a global vaccine are really obvious.
Yeah.
So talking a little bit more about the indirect effects of COVID and the increases in child deaths, domestic violence, child marriage. What are your biggest concerns, stepping away from the vaccine in a way, but what are your biggest concerns about how to avert these increases as we also tackle COVID?
Yeah, I think one thing I read that really has resonated with me is there's a lot of uncertainty about the impact of COVID-19 in low-income countries, but actually we have total certainty on the impact of stopping these other very cost-effective, already proven services for non-COVID reasons. And so, I think it's very wise and cautious to have put down lockdown and to interrupt services when we really didn't know anything about COVID. That was cautious. But we're now entering a new phase of the outbreak where we need to weigh the costs and benefits. And the question is not lockdown versus no lockdown. It's more nuanced lockdown, more workable lockdown, while we enable these other essential services to be provided. I mean, even in the United States, we've already seen vaccination rates drop by like 20% in a context where we were already hugely under-immunized for measles. So why would we want to see something like that in the rest of the world? It's really something we have to pay attention to. But I think one point that you are making that's super important is, do we have to test what safe provision looks like in some of these settings? Can we do a regular immunization campaign with people wearing PPE, or is that not viable at all? It's all about the risks and the benefits, and the compensation that you're going to provide to health workers who are, risking exposure. So these are all things that kind of remain untested, but we need to look into quickly.
Yeah, I mean, I think it's always nice to hear, it's like you had that initial, and maybe you're getting out of it a little bit where we didn't know anything and now we know a little bit more.
Yeah,
but we also need, what you're saying is test even as our assumptions as we go forward. And it is really interesting to see what's happening. Even Gavi, they're, ramping up immunization campaigns after this initial, the halt.
Right.
But I've seen some criticism from you about what's happening with the World Health Organization. I don't know if you would characterize it like that, but I would love to hear from you some of your ideas about the ideal oversight and positioning that would be good for WHO to have now and in the future. What are your thoughts on that?
I think there is a need to really emphasize and prioritize and put above all other things on the WHO agenda, global health security and preparedness. I think it's obviously the most important thing that they do. Um, but I also think that the assessed contributions should be increased so we don't have this problem of people, uh, you know, not paying as much as we need to run the organization at a decent level. So I guess it's a combination of sort of prioritizing within the priorities that they have, and second, funding them adequately.
Okay, great. Yeah. So, um, also, what I'm hearing is you're not saying that um, it seems like our current situation has only shown the WHO as a potentially very important organization that needs to be empowered as opposed to disempowered, but maybe empowered in a apolitical, science based way.
Yeah.
Yeah.
I mean, I don't know. I mean, it's a bit of a dilemma, isn't it? I'm sure that there are other greater experts on this than I am, but it's just a pity that it's so politicized, and yet one recognizes it's a political organization owned by its governments. So it's sort of inevitable that that is the situation. I guess maybe the question is, does the governing mechanism enable the resolution of political conflicts in a way that is win-win for the world, or does the setup, you know, I mean, it just doesn't work if people drop out, right? I mean, that's sort of defying the entire purpose. So, um, yeah. I mean, Russia and the United States were able to both be members of the World Health Organization through decades of the Cold War. Presumably, we can get it together so that we can be in multilateral organizations with the government of China with no problem. So part of it's just the administration and the fact that we're in a pre-electoral period in the United States. But we have to give the space to have the conversations and the disagreements that exist, but to have them in a way that is more constructive.
Are you starting to advocate for any sort of look back on what has happened and sort of what went wrong, and the need to do that for the next pandemic, or
So they have the WHO Director General just announced such a independent assessment, and I mean, yes, but we had six external panels and an internal lessons learned kind of assessment, and an ongoing panel that oversaw preparedness in the wake of the 2013-14 Ebola outbreak. And I think what's clear is that there is this idea that outbreaks that are dangerous only occur and can't be managed only in low-income countries, and that is absolutely wrong, as we've seen today. And it's also shown by the fact that lots of efforts to rank preparedness suggest that many of the countries that are really having trouble with this outbreak are among the best prepared. How do we explain that? And we needed to be sort of thinking through what that would mean. And this isn't the worst case scenario, right? I mean, this isn't pandemic flu, and this is not with a 10% mortality rate. This is, less. It's anyhow. So I think that this is our warning that we need the mechanism to be truly global and to encompass the high income countries and to treat them as this is a global issue. It is not a development issue only, or a low middle income country issue. And I think that's really, maybe when we talk about the World Health Organization, I think in many ways people thought of it as the low and middle income country agency, and that's the wrong way to think about it. So what is our plan?
I think that's a really important, interesting point for sure. Now, our time is about out, so I wanted to make sure, is there anything else you want to talk about, or anything that I didn't ask you about that you feel like is important to bring up?
Um, so I do think, when we also talked about we talked about health priorities that might be missed in the response to COVID-19 through the interruption of services, but we didn't talk about other kinds of things that are happening as the result of the economic collapse, things like not being in school for many years. Some of my colleagues have done some really interesting research that shows how dropout risk is increased, how people may never go back to school, how some of the kind of phone surveys that are coming in now suggest that the use of radio or tele-based options for education are not happening in low middle income countries, and that really is very too high of an opportunity cost. So you can always run a catch-up immunization campaign. It's very hard to get back a year of early childhood education, for example. So I think that's another kind of collateral effect. And then the issue of domestic violence. One thing people have said is that, oh, actually crime is down in some of the lockdown countries, like South Africa, for example, has had a very a huge drop in both road traffic accidents and other kinds of crime and murder. But what about what is happening at home? And that appears to be increasing significantly. So these are all things that we need to worry about and think about policy solutions for.
Yeah, definitely. Yeah, thank you for sharing all those. We'll have to link to some of these resources
Okay.
in our when we share this video, and I really appreciate you taking the time to speak with us.
Okay, thanks, Natalie.